More on this. Angelique Coetzee, a medical clinician, joins us from Johannesburg, South Africa. Some good work there, clearly, by doctors and scientists in Namibia. Briefly, what more do African countries need to do to help stem the spread of HIV?
Good evening, and good evening to all your listeners out there. I first also need to congratulate Namibia on this achievement. It's really, really an amazing achievement. So coming back to what other countries need to do in Africa. So if you look at the situation in Namibia, Namibia has made a political and financial decision when they tried to address the inequalities by prioritizing our HIV prevention and the control, and therefore they are also one of the few countries in sub-Saharan Africa that achieved a treatment of 95%, where 95% of adults between 15 to 49 years old are aware of their HIV status, and of whom then 97% were accessing HIV treatment. They have access to HIV treatment, and then 94% and more has a viral load that is being suppressed. So it is extremely important to see and to follow the pattern. So what they did as well, and other African countries can do exactly the same, is to look at not HIV in isolation, but to bring the community in, to bring the people themselves, the mothers in, to train the doctors, to train the nurses, to have open access to HIV treatment, especially for mother to child, so your pregnant women, to get them to start taking ARVs when they're pregnant and they're positive. They also supported these women.
And Angelique, I'm so sorry to interrupt you, just because we're running out of time, I'm afraid. Just really briefly, you know, we're just a few decades on from when HIV/AIDS we first became aware of it as a terrible illness, and I just wonder whether you could see a future where HIV/AIDS was eradicated in Africa, or am I jumping the gun completely here? Very briefly.
It can be eradicated, definitely. If you look at, again, Namibia, they are an excellent example of how one should do it. Other African countries should follow their example, and we should applaud people trying to lessen the triple quadrant of burden of disease, where you look at not HIV, but also syphilis and hepatitis B. It can be eradicated. It's not a disease that you need to be afraid of, and you need to take the stigma away. And these people need to understand that if I'm HIV positive, it's fine. It's like, you know, I need to take my treatment as I would have done if I've got diabetes or hypertension.
And Angelique, I'm so sorry, we have to stop it there, but I am going to stop you at least on an optimistic note. Thank you so much for coming on the programme. We really appreciate it.
Pleasure.